Modern medication did not work for me. Modern medication did not work for me. Modern medication did not work for me. Modern medication.
Well, this is Mercy TV, another covert experience.
Hello and welcome to Mercy TV, episode We Forget during the COVID-19 pandemic. Thought we'd be here a few months. Here we are approaching a year and no end in sight. Hopefully that will change with a new group of people in Washington, D.C. if that comes about.
Washington.
But the important thing is that we here now are talking about medical cannabis law reform and how it currently is and how it should be and how we get there. Along with all kinds of tales, tips, and factoids. Greetings. I'm Perry Normal. This is producer PK, Sonny, and our friend, visitor,
Yes, sir.
by the name of
Jose?
Jose.
Yo.
Welcome,
You.
Jose.
Yeah.
And this is Mercy TV, your source for news and information on the cannabis issue with a focus on the medical. Find out more about Mercy TV and Mercy, the Medical Cannabis Resource Center, at mercycenters.org. BK?
Hey, if you're enjoying to smoking cannabis, use your own device. We need to keep this virus into check. We need to get back to normalcy.
Friend.
Yes, sir.
Thank you.
Yeah.
Thank you.
Oh, yeah.
Thank you.
Okay. Right.
See,
Yes.
see. De nada.
Nada.
Yes, sir. Thank you.
Amigo.
Yes.
Amigo.
Amigos.
Amigos. Amigos.
Amigos,
Amigos.
which I think believe means
Yes.
friend.
Yes, sir.
Mexico y todo. Just,
Yes. And that's the cameras.
yes.
And that points out that our website has information on Mexico and several other states, and you can translate the pages depending on what language you want to read them in. We were talking earlier before the show about medical cannabis, and since sports season, the pro sports, and also college sports, as many of the folks go through a lot of the same
Pain.
conditions and symptoms,
Well, there's so many colleges out
not
there,
the least of which is pain, right?
you know, and those are going through so many things because the colleges, those kids, they're trying to get an education, they're trying to play sports, and they're dealing with injuries, and they got drugs they're trying to take, and those drugs are approved, and here, you know, we just had 4 states get approved for medical. You know, those states, they got cannabis they can use, and those kids can use, and those are the benefits, you know. And
Well, in some cases, some of these states have 21 and older laws, and so some of these kids, still 18 and such, may not qualify, even though, or some other nonsense like residency. I remember we had to dick around with that too. So it's no guarantee, but it's a progress. It's a step. Unfortunately, many college programs, as well as professional sports teams, have clauses in their contracts that, irregardless of state law, the cannabis is still prohibited.
New Mexico is dealing with it. Their basketball team is moving, you know. The pro sports is dealing with it. There's a lot of, you know, we got a lot of education to deal with.
Well, they're dealing with a lot of these injuries, a lot of conditions that people are going through, that medical cannabis is known, proven, at least by common use common sense. You know, the federal government still refuses to officially recognize it, even as they allow components of cannabis like CBD to be widely sold and advertised as a cure for everything. Hell,
Well,
Everything.
there's many
Everything.
different components of the cannabis plant, and many are helpful for the healing process, to relieve the pain, the chronic pain that you have. I have a carpal tunnel and other things that I've used this healing oil on.
Well, I have seizures. I've got, psoriasis. I got psoriasis on my arms. I got it on my legs. I got it everywhere. Oh yeah, I got arthritis. My friend here, he's got arthritis in his arms, and I mean, there's lots of things that we got, but we take pills, and those pills that we take from the doctor, the cannabis helps. And once you find out how the cannabis works, because you talk with your doctor and they take blood tests. And once you find out how those blood tests, how good they are with the cannabis, because the cannabis will work with those pills. Some are better, some are, because it works with you, it works with you, it works with him, and we get all kinds, depending on what you eat,
So- People at the hospital, and you are watching this program, please talk to your doctors about the use of cannabis instead of, or to help the drugs that they prescribe to you. I mean, you don't have to smoke it to get the benefits of it. The healing oil is out of olive oil, and you just rub it on, or you can add it to your food. You can make up a butter. You can make up another tincture with words that I can't pronounce. Hey, but please talk to your doctor, and when it's time, read the things on the voting. We need to get the right people in the office. And if you're not sure, please just write your name down, because it's better than what they're offering.
right, and
know-
not voting.
very important, very important.
Yeah.
When you talk to your doctors, talk to your legislators, talk to the senators. We have so much going on with the pandemic, talk with your family, talk with your kids, talk with your neighbors, You can send emails, we can do anything. We have this law today. We can grow these plants. We can grow these plants. We can eat them. We can make the oils.
And we can use even up to the roots to make a CBD concoction to make you feel better and cure what's ailing you.
And you can always take what you have and use it to make something else. You can use it and make something that you didn't know you could make, and use it, and then you'll get the benefit from it. You can bake with it. You can do whatever that you know how to do, and you can take it and make the oils, or bake, or make breads, or make rolls. What do you know how to do? If you
And
know how
what
to
ingredients you have in the cupboard, or you
Use
can
them.
afford.
use them. Once you use what you have, and you take the cannabis that you have and you use it, see what benefits you get. Because you get the benefits, he gets the benefits, he gets the benefits. He'll get it one way, he'll get it another way, I'll get it. But you got to do it more than once. You can't just do it one time.
But
One time.
hey, the one time helps because it introduces the cannabis
To your
into body, and you need to keep. It's like with the prescriptions you would get from the doctor. he would give you a little bit and you would take it several times a day to get your
Your body
system,
working.
yeah, and your immune system. You gotta keep your immune system healthy
Just about what?
to keep your body surviving.
Okay.
Adios, amigo.
No.
Be careful, don't trip over
No,
your
ahorita
big
vengo,
feet.
ahorita. Okay.
Yeah.
Okay.
Okay.
All right.
De nada.
None. Thank you.
Well, there was a smooth transition.
We are scared. I hope we were not scaring you away
I think he's got to
either.
go to the bathroom.
Ah.
But see, these are the things that you learn once you start working with the cannabis plant. And you can use it topically, and you can use it by smoking it, and you can use it by drinking, because you can do lots of the teas and the different things that you can make. Because depending on the condition that you have, people learn that because sometimes you're nauseous, and you can't eat or drink nothing, you have to smoke. See, that's the other thing. Depending on your condition, because his condition is one thing, his condition is another. Back to the sports and the college kids. They got lots of issues they're trying to deal with. So we're trying to help them get an education, provide them some sports, because they're trying to play some games and get these sports, that they're doing. And it's just, all over the United States, these got it going on. They're playing. They're trying to get into the games that they're playing and get this, because they're on the East Coast, they're playing, on the West Coast, they're playing them. Whether it's the basketball, the soccer, they're doing it. They're all playing.
Uh-huh.
And the professionals are too. The difference, they're all, they haven't got it legalized yet. And that's the problem. We need to legalize it for them so they can get the benefit out of it and let the benefits get...
Vaya, amigos.
Bye.
Okay, thank you. Thank you so much.
Yeah. Okay. Thank you very much.
Adios,
And maybe
amigo.
next week
Safe
you can come.
journeys.
Okay.
Okay?
Okay, ahorita.
Be
Un
safe.
momento, ahorita vengo.
Okay.
Merci. Gracias.
¿Gustan una
De
cheve?
nada.
Una cheve? Budweiser?
He wants to wash the car. Do you?
Chevy? No. Do I sabe?
Budweiser? Oh.
I'm not sure.
We're on TV.
No.
Thank
We're-
you.
Sorry.
Go.
Not
Thanks.
sure, brother. I am so...
Hey, bro.
Thank you.
Thank you.
Okay.
Thank you so much.
Adios, amigo.
Okay.
Thank you.
See.
Have a good
Gracias.
week.
Take care.
Be safe.
Yes.
I guess.
See, we have a lot of
Hope the
people.
place isn't on fire or something. So.
We have a lot of people in the neighborhood that I can't talk their language, but I try to
Socialize.
share with them and let them know that, if they need anything or help, I will come and help them, so they know if they want me to come and they need, some work or whatever, I'll come and help them.
Uh-huh.
He didn't need me or he'd be going,
Okay. Yeah, I'm not sure what he was trying to say there. We have to
He
get a
was leaving.
translator someday.
Yeah.
Yeah. I need to learn more Spanish. We're sorry.
But back to the show.
Yes. Everybody, please know that the cannabis is good for you. And you need to share with your doctor. And the pills that he's given you get good, but the cannabis will work with them. And your doctor might decide that he don't want you to use them, or he might to lower them, the milligrams that you're taking, and that's why he takes the blood tests.
Right.
And the people in the hospital, these are the things and the benefits you get from using cannabis, whether it's topically or drinking it or smoking with it. These are all of the things that you learn, but you are the patient and you have to do this yourself and talk the communication with your
Right,
doctor.
yeah.
Don't
And it's
be
so
afraid.
important. And you can't be scared, and you can't not do that with your doctor. You have to allow your doctor to give you those pills and work with them, and he's going to do this, and you're going to be using the cannabis, and he'll see it when he gets the blood test will show that you're getting better, or and depending on what you're eating or how much you're drinking, all these things, because your organs work, your vital organs, whether it's your liver, your kidneys, your blood gets better. Your pancreas, all of these things get better. The cannabis works, and it will make those better. And when it does, he'll go, wow. And you can explain to him, you're eating cookies, whether it's the oils, there's so much. And you'll learn that whether you're eating all the foods that you can make, because like we was talking earlier, you'll find out maybe there's some certain foods you like to make or you like to eat, or the oils that you do, because some people, I was talking with a patient the other day, and he was telling me there's only a certain kind of donut that he likes to make and eat. And that's kind of funny we got to this part, because I told him, well, that's because we've had special diets before. And that's when you find out you have a special kind of donut that you like, well, you take that donut and you take that one kind of donut you like. You can do so much with that one donut and make that donut, but you can make that one kind of donut out of that oil and do so much with that one donut because it's a special donut. Well, you work that donut because it's a special donut. It's a cannabis donut, but you can do so much with that one cannabis donut. And that's what we did. And by the time I got done talking with that patient that day, he was so happy because he was getting off the phone and going to tell me all the things he was going to do. And this is what you learn. You can do so much with it. And you, as the patient, you learn, man, I can do so much with it. And when you can do all of that and you feel so good and your body recovers, and because your body starts learning what it needs. And the doctor, when he takes his blood test, says, wow, your body is doing so much with it. Because the cannabis will take what it needs and get rid and pass what it doesn't need. And that's what you learn. And these are the things you want to do. And you try it once, and then you start doing it on a regular basis. And, if you don't know some things, or you do need to share about a condition, please write Perry, let him know, because these are how we learn and we pass on, and how we write new laws and get them on the...
Well, though that information ends up being a part of the testimony of people who are getting these laws passed, like we saw in 4 states here this last election cycle. And that's a heads up that we need people to continue to register and vote in record numbers like we saw this cycle for this and pretty much every issue that an American cares about. Then that's the solution. Register, vote, get everybody to do so also. And every cycle, it's good. They're coming 2021. People are going to say, so what? There's no candidates really on the ballot, certainly not president.
So put your own name down if you're not sure.
But there'll be measures to vote on and possibly candidates because of runoffs or some other situation. The important thing is that 2021 is a practice for 2022, where we're really going to need that effort, So take 2 years to get everybody registered, going door to door and all that stuff. And then after 2022 is again another mid-year where it's 2023, where we got the same thing. There'll be measures, some possible candidates, but it's practice, if nothing else, for 2024, which is going to be another big year. A lot of voter suppression by the people that don't want to change the cannabis laws, that want to keep status quo, which is everything's illegal. So it's who to get permission, more or less, to do illegal things, It seems to be the way, everything's illegal except if you know somebody, then it's okay.
Well,
and all that. And
this is why, if you're a patient of the medical cannabis or marijuana, please keep up your membership. We need to keep this program together, even though we know we're just paying protection money to be able to grow our own cannabis. And I've been showing you over the years the process, and please tell me, how does it taste? I mean, does it
Good.
help your mind in one way?
That's another thing. Some people have talked to us about the benefits they get. They were doing it for one reason, and they ended up feeling so much better. You know, their mental health was so much better. They felt one way because they were hurting. You know, they were feeling so depressed and feeling so bad and not feeling good, and now they feel so happy. They're feeling so good. And you know, does the cannabis have something to do with that? Well, of course. You know, they're feeling good, they're feeling happy, their legs and stuff are feeling so much better. And now, hey, you know, it ain't perfect because they're still hurting, you know, because they're hurt.
well,
But
I think that it's important to note, that what Sonny's saying is true. These things are helping. They're helping in a whole body way. Some of the benefits, it's more than just a feel-good thing. It's not just helping to reduce pain, which is no small thing. If you've got the pain, especially if it's debilitating and so forth. But with the nausea, with the stiffness and soreness, with swelling, with skin conditions, which might not be debilitating and so forth, but is still discomforting, and people can actually not feel like going out when they're suffering under, some extreme, effects of the people when it gets really bad for them. This cannabis can be applied safely and effectively. Again, as my cohorts in Common Sense Compassion have said, you don't have to smoke it. You can make teas and tinctures, oils, and
Even beer.
well, because people are afraid they smell, they stink, because when they smoke it,
right. And so, a number of ways to apply it where you don't have any of the effects of smoking it, be it emanate the smell of smoking, which also works with vaporizing, by the way, just to throw that in. So these are the things to educate your doctor with, your friends, your family, your coworkers, your neighbors, your friends, your enemies. What the heck? What have you got to lose? Yeah. Slash family. If you haven't spoken to them all here, here's a good reason maybe. They're suffering. We take it out of the action. But I think an important, other side of that is that cannabis is a safe medicine. There's no overdose amount that you can take. Hell, there's an overdose amount of aspirin can kill you, but not cannabis. It works for some. It works greatly for some. It's a miracle. For others, it's not as effective. Possibly the way they're taking or maintaining it, but nobody freaking dies from it.
So, if you do overdose, it does help you have the higher level of the THC and the other cannabinoids that are in the cannabis plant and the hemp plant. We could have saved thousands of forests because we were using hemp as the material instead of lumber. And it was because of the ignorance of the big oil. And you could even use the oil out of the hemp seed to make a vehicle go. And the panels on your vehicle were, God, the insurance companies wouldn't make any money from the auto accidents.
And that would be a darn shame. Well, we got 3 minutes left, so let's wrap up and say, hey, all the folks that helped us to do the show
CCTV.
over the years.
You know, thank you. You know, they've done so much to make this show possible. And it's Thanksgiving time. You know, Thanksgiving to everybody out there. You know, we've been doing this and make it, you know, thank you. You know, we got so many.
They're very thankful. Yes.
Thank you.
Peace and victory for us cannabis users. But I want to thank Nurse Ed.
Yes.
He went through a lot. Dr. Lebec, really.
Yes.
He was the best.
So much.
Shauna, Mike,
Sam.
Ruben. Hey, please, if you're on our website, hit the PayPal and donate. We need your help.
Give Perry a mess. You know, we can, if you need some help, if you want somebody to go to the doctor with you, I'll go to the doctor with you. If you need some help, we talk to the doctors with you. You know, we talk because, you know, some people don't want to talk with their doctors about the cannabis. We'll do that.
Education.
Very important.
People in the hospital. Get well. Talk to you.
Stay safe.
Yeah.
You know,
Mask up. Use your solution, your lotions.
6
All
feet
that
away
stuff where
or
you can.
better.
Woohoo!
We love you.
Thanks for watching. Spread the word. Visit our website, mercycenters.org, for back issues and episodes.
Hey, if you're on a windy day, go fly a kite and have fun watching it float.
Thanks for
Thank you.
visiting. We'll see you next time on Mercy TV.
Bye-bye. Peace and victory for us all.
many blessings.
Happy holidays. You want to say anything before I turn it off, Glenn?
Yes, good night.
Good night. God bless you all, every single one of you.